Welcome to this training video on SELF Waiver services. This training is designed to provide information about the Self-Empowered Life Funding Waiver, also known as the SELF Waiver, and the changes we will see effective July 1st of 2022. In this training, we will learn about what is new with the SELF Waiver, eligibility, budgets, and updates to definitions. We will also learn about updates to budget authority, employer authority, and financial management services entity. We will talk about changes to participant-directed goods and services, as well as new services within the SELF Waiver of self-directed transportation and home-delivered meals. At the end of the training, we will provide an updated list of services offered in the SELF Waiver and resources that can be utilized with authorizing and using the SELF Waiver.
Hi, my name is Gary Tonks. I'm the president and CEO of the Arc of Ohio, and I want to talk to you today about some of the changes coming to the SELF Waiver this summer. So we're going to be adding some services, and we're going to be changing some things that those of us who have been around for a while have gotten used to with the SELF Waiver, and I think the changes are for the good. So two of the new services we're adding to the SELF Waiver are, one, home-delivered meals, two, self-directed transportation. The second one there is a new concept for us, and we're going to talk about both of these new services later in this presentation. For those of you who have been administering this waiver for a while, we're no longer going to need you to complete that pre-screening tool. We're also going to be moving away from two concepts. Concept of least expensive. I'm going to do the cheapest. We're moving away from that. And we're also going to be moving away from medical necessity. Waivers are all about living in the home and the community. It's not the medical model. So we're going to be moving away from that terminology and moving toward habilitative intent. What's going to benefit that person as they continue to live in their home and the community? We're also going to be increasing rates for waiver nurse delegation and clinical therapeutic intervention. We're going to increase the rates, and hopefully that needed service will be used more often. So eligibility, how do I become eligible for the SELF Waiver? Number one, with all waivers, you have to be eligible for Medicaid. They have to have a developmental disabilities level of care. They're going to need at least one of the SELF Waiver services that we're going to go into in more detail later. The county has to be able to assure that this child or an adult is going to be both healthy and safe using the SELF Waiver services, and that $45,000 or $30,000 is going to be enough to maintain and assure their health and safety. They also have to be able to manage a budget and be able to choose and carry out at least one of the services. But they can have someone in their life that can help them do that. There's no age requirement for this or other waivers. They're birth to the end of life. And unlike the Level 1 and the IO waiver, the SELF Waiver requires that the person enrolled on the waiver, they have to be able to choose and direct at least one of the services. So I mentioned budgets. If I'm a child, $30,000. If I'm an adult, it's a $45,000 per waiver span. Gets a little more complicated into what does adult mean, what does child mean. This is not under 18 and 18 and over. A child is someone under the age of 22 who is still enrolled in an educational service. So if I've socially graduated at 18, yet I'm still officially enrolled, I'm a child. If I'm 19 and I have graduated and left the school system, I'm an adult and I have a $45,000 budget. Keep those things in mind. This is based on whether I'm still in school or not and whether I'm under or over 22. Within that budget, there are certain caps. Support brokerage is one of the services. That spending on the support broker service cannot exceed $8,000 per waiver span. Assistive technology cannot exceed $5,000 in any waiver span. The functional behavioral assessment is up to $1,500 per waiver span. And while I could use all of my budget theoretically for a service called participant directed goods and services, if you're using that for environmental accessibility projects, home modifications, if it's over $10,000 in one expenditure, you've got to get review from the Ohio Department of Developmental Disabilities. So budget authority. I really get to control the services and my budget in this waiver. And I have specific authority with clinical therapeutic intervention, participant-directed goods and services, participant-directed homemaker personal care, support brokerage, and self-directed transportation. That's going to allow me to negotiate the rates of payments to the providers of those services within some parameters. You also, in this waiver, have something called employer authority, and there are two types of employer authority: common law and co-employer. Within that includes the staff I'm going to hire to support me, participant-directed homemaker personal care, the people I'm going to employ to help me get around, self-directed transportation, and the person that's going to help guide me through the ISP process and help me negotiate how much I pay the above two service categories, the support broker.
Hi everyone, my name is Dana Charlton and I'm the Executive Director of the Ohio Self-Determination Association, better known as OSDA. I'm here today to help do training on the changes to the SELF Waiver, Self-Empowered Life Funding. So let's get started. Now that you have heard the definition for employer authority, let's talk more about the two different types: common law employer and co-employer. The word person used in this slide means the individual who receives self-waiver services. To keep it simple, let's say this is you, and you have selected employer authority because you want to recruit, hire, supervise, and give direction to your staff. If you choose employer authority for a service that allows for it, then you will need to decide if you want to be your staff's common law employer or if you want a co-employer. With both choices, necessary payroll functions will be done for you. The biggest difference between common law and co-employer is whether you or your co-employer is legally responsible for all employment-related functions. If you choose co-employer, it can be either a financial management services entity or FMS that's under contract with the state, or it can be an agency with choice. The FMS or the agency with choice may just support your employment of staff or may also support you in other ways, including providing traditional agency-based staff. Let's talk more about a financial management services entity. Remember, FMS for short. The FMS is a government or another third-party organization or entity that is assigned by the Department of Developmental Disabilities to take care of necessary financial transactions or activities that any employer has to do. Some of the transactions or activities the FMS can do are listed on this slide. Things like paying invoices or bills, tracking expenditures, which means watching how much you spend so you don't run out of money before the end of your waiver span. The FMS can operate a payroll service and make payroll withholdings. which means sending your provider or your vendor a check for the work that has been done, and as needed, holding back state and federal taxes and other required withholdings. An example of a self-waiver service with only budget authority is Participant-Directed Goods and Services, PDGS. The information on the slide covers important revisions to this service, which has been in the self-waiver since the waiver's beginning. PDGS includes services, equipment, or supplies that you cannot get through the Medicaid state plan or through another waiver service. Because PDGS does not require that equipment and services be provided by a Medicaid certified provider, such things can be obtained from the same community sources that all citizens use. For example, if you need it, you could hire a person or a company to clean your house or mow your lawn. It is important to remember that PDGS must be something you need that is talked about in your assessment, is identified in your individual service plan, and linked to what you want to achieve, meaning it will help you in one or more of the following ways listed on the slide. There are some things that you are not allowed or permitted to get using PDGS. These things are listed in the PDGS rule. PDGS does not pay for pools, spas, or saunas, and it cannot be used to purchase food, tobacco, or alcohol. PDGS cannot be used for anything that is only for entertainment or recreational purposes. Remember, it has to show up in your assessment as something you need in order to achieve something in your service plan, and it needs to be in your service plan. You cannot use PDGS to purchase items that are illegal or prohibited by federal or state law or requirements. No internet or phone service can be covered by PDGS, as these are considered something of general utility. In the same way, general utility is electricity, water, and gas. One way to think about general utility items is to think of things you would expect to find in the home of every citizen and not be something needed because someone has a disability. The revised PDGS rule, which has an effective date of July 1, 2022, no longer refers to the county board's established cost comparison process, nor to having a review committee. Instead, it is strongly recommended that each county board now have their own review process for PDGS purchases of $500 or more. The PDGS rule also lists certain items that will continue to require approval by the Department of Developmental Disabilities. These are generators, fences, play sets, home modifications over $10,000, and services that are expected to be the responsibility of the local school district and usually found in an individual education plan, or IEP. At times, items that are available through other waiver services from a certified Medicaid provider may not adequately meet the assessed need of the person and can be covered by PDGS, but only with the approval of the Department of Developmental Disabilities.
Thank you, Dana. My name is Quincy Jones and I am a Service and Support Administration Manager with Cuyahoga County. The next service we will cover is home delivered meals. This is a service that has been available in both the IO and Level 1 waiver, but is now being added to the SELF waiver. Home delivered meals is a service that is exactly what the name suggests. Meals are prepared, packaged, and delivered directly to a person's home. This service supports up to 2 meals per day. The choices have been expanded to include a standard meal, a kosher meal, and a therapeutic meal. The payment rates have also been increased from those previously in the IO and Level 1 waivers. The rates for a standard meal is $7.20, and for both kosher and therapeutic meals, the rate is $8.68. When authorizing this service, the Service and Support Administrator will need to include the meal type in the ISP. Now we will cover self-directed transportation. This is a new service and should provide more opportunities for a person to have greater independence and access. The addition of this service should be a very welcome addition. This service is available around the clock, including weekends and holidays, to accommodate on-demand and scheduled transportation needs. The intent is to allow people the option to travel independently. This should help solve a lot of issues those we support have with accessing the community. There are two ways to use self-directed transportation. The first is the purchase of prepaid vouchers, cards, passes, or tokens to access typical modes of ground transportation, such as Uber, Lyft, buses, and cabs, just like you or I would. The second way is for the person to actually choose a family member, friend, or neighbor to transport them to their activities of choice. Even though this person will need to be approved through the financial management service entity, it is still an outstanding opportunity for people to go where they choose to go. This service will definitely break down some barriers for a lot of people. Let's discuss who can benefit from self-directed transportation. People working in the community with late hours, irregular shifts, or on the weekends. People looking to access community activities during the evening, weekends, or other times when transportation hasn't been available. An example would be someone just found out their friend's surprise party is later tonight, or someone gave them tickets to the Browns game tomorrow. Now they could already have transportation set up for those types of unplanned events. Another group are people looking for more community-based or typically available transportation providers. Who would also benefit are people wanting to navigate the community independently without them receiving another waiver service at the same time. And lastly, when people want to access transportation options that have not previously been available to them, as I stated in one of my previous examples. So, who can provide self-directed transportation? As we covered earlier, a vendor of ground transportation available to the general public can provide this service. Someone chosen by the person, the provider will receive either per trip or per mile reimbursement in accordance with the written agreement to provide this service to the person. In order for them to receive this reimbursement, the provider must bill for those services through the FMS entity and will be paid by the FMS entity. And lastly, an agency provider or independent provider certified by the department to provide non-medical transportation or transportation in accordance with the rule. On the screen, you will see a listing of all the services provided under the SELF Waiver. I am going to walk through this list with you. Participant-directed HPC, participant-directed goods and services, participant family stability assistance, assistive technology, remote support, support brokerage, transportation, the new service we discussed, self-directed transportation. Another new service we discussed is home-delivered meals, waiver nursing delegation, adult day supports, community respite, residential respite, career planning, clinical therapeutic intervention, functional behavioral assessment, group employment support, individual employment support, non-medical transportation, and vocational habilitation.
Thank you for participating in today's training on the SELF Waiver and changes that will be effective July 1st of 2022. Resources that are available to you are the updated SELF Waiver Handbook, SELF Waiver Changes one-page handout, Self-Directed Transportation one-page handout, and the Home Delivered Meals one-page handout. These resources will be saved on the DoDD website for quick access. To find the newly amended SELF rule, you may click on the link provided on this page or search OAC 5123-9-40 on the DoDD website under Forms and Rules tab. If you have questions about changes, you can submit those to waiverpolicyta@dodd.ohio.gov. Thanks and have a great day.